Hello, my name is May Mustafa. I'm in the nurse practitioner program at Eastern Kentucky University. My presentation is about integrative review. It does talk about the PCOT question, which was in older patients with diagnosis of major depression disorder. How does prescribing antidepressant medication alone compared to combining prescribing antidepressant medication with cognitive behavioral therapy affect the overall control of the depression symptoms within a period of 6 months? The population that those studies were on adult population. Several research studies have been developed to answer the question of how does prescribing antidepressant alone compare to combining prescribing antidepressant with cognitive behavioral therapy effect on the overall control of depressive symptoms. This is particularly important because lately clinicians have relied on medication for the treatment of several conditions, including major depressive disorder. I picked 3 relevant studies reviewed trying to answer our question. The first study was rational emotive behavioral therapy, cognitive therapy, and medication in the treatment of major depressive disorder. A randomized clinical trial was picked, post-treatment outcome, and 6 months follow-up. The second study was cognitive behavioral approach to loss of clinical effect during long-term antidepressant treatment. A pilot study was picked for this research and tested added cognitive behavioral therapy to treat loss of clinical effect during the long-term antidepressant therapy and compare it to medication dose increase. The third study it was effectiveness of cognitive behavioral therapy plus pharmacotherapy in inpatient treatment of depressive disorder. A naturalistic study that tested the effectiveness of combined cognitive behavioral therapy plus pharmacotherapy in the inpatient treatment of depressive disorder. The findings of the 3 studies were consistent with other available research indicate that combining cognitive behavioral therapy with antidepressant medication are more efficient in treatment of depressive disorder than using the antidepressant medication alone. Studies also showed that application of the cognitive behavioral therapy can be beneficial in controlling loss of clinical effect during the long-term antidepressant treatment and may carry long-term effect benefit. Patients who were treated with combined approach showed a considerable greater reduction of symptoms and remission rate were significantly higher. Based on this finding of those studies, we can assume that combining cognitive behavioral therapy with antidepressant medication would be the most favorable approach in treatment of major depressive disorder, and this approach should be explored in the treatment of those patients to achieve the optimal outcome. As a nurse practitioner, I would like to apply using the cognitive behavioral therapy, adding it to the prescribing of the antidepressant medication, or at least refer my patients to a psychiatrist or specialty that they can combine both. That would conclude my presentation, and thank you so much for listening.